available. I am joined now by Niall Dickson, the Chief Executive of the NHS Confederation, which represents hospitals and NHS bodies, and Dr Helena McCorn, a GP who's chair of the British Medical Association. Dr Helena McCorn, first, just to get you to respond to what we've just heard from Juliana Duntony there. She waited a long while for NHS 111 to respond, and she still hasn't got her test results. Is that a fairly typical picture, do you think? Does NHS 111 have the resources?
We have heard at the British Medical Association that there is quite a long time for some patients to wait for NHS 111, and I'm really sorry for Juliana waiting for the result as well. My understanding is over the last few days, more members of NHS 111 have been drafted in to do extra hours to reduce this wait, and there's also a way that you can email NHS 111. But I would really urge that people are patient and do continue to do that, because that's part of how we will contain this, and containment is still a very real possibility.
Well, Niall Dickson, we get the government's battle plan, in inverted commas, tomorrow. What is the worst-case scenario that you're preparing for?
Well, there's an escalation plan, clearly, and one has to emphasise we are still in a containment phase. I think one of the concerns, obviously, is there are 2 people that we know of who we are not sure where they got it. It seems to have been intra-Britain transmission, and that is a matter of concern, trying to trace them. The other cases are less of concern because we've managed to trace, we know where they got the virus in the first place. So I think the answer is that they will announce tomorrow, and I haven't seen the detail of it, an escalation plan, and that's what the NHS is normally geared up for. So as more cases come in, then of course routine operations may have to be put off. Clearly that the routine clinics, anything that really can be deferred, will be deferred, depending on the level of pressure. New wards will be created in order to deal with patients who need treatment,
in hospitals,
as it were.
Or in schools?
No, in hospitals, that's where people will be treated if they are vulnerable and they need that special kind of treatment. The good news, again, about this virus is that for the vast majority of people, it's a relatively trivial illness. That actually makes it more difficult to detect as well. But it does mean that for most people, except the most vulnerable, then it isn't so much of a problem.
How worried are you when you hear that? How worried are you? Is this something you're playing down, or are you concerned that the NHS might be brought to its knees by this?
I'm very worried because I'm aware that if you go to an emergency department, if you go into a hospital, if you try and get a routine appointment with your general practitioner, that the service is what I would consider 99% full already. It is good to hear from Niall that there are spaces in hospitals that could be turned into wards. However, I'm very concerned by the NHS staff survey only 10 days ago that 56% of our NHS staff already go into work unwell, and I cannot ask people to be doing that now because that would potentially spread illness, and that the NHS already is causing stress in 40% of our workers.
And you talk about more wards. I mean, in Wuhan, they built a whole series of new hospitals. Are you confident that in a worst-case scenario, which suggested that 1 in 10 people could be hospitalised, do you have enough critical care beds in NHS England?
No, there will eventually come a time, if the virus absolutely takes hold everywhere, where, of course, the NHS will then have to prioritise further. But we are...
What does that mean, though, in practice?
Well, that means in practice that you will say, for example, that you will be treating, you'll prioritise your patients. So the most vulnerable patients will get treatment. Those who are less vulnerable are less likely to be treated. That is the normal situation in which the NHS would normally deal in any crisis situation. And
doesn't that mean more people will die, though, without wishing to be alarmist?
Well, it is inevitable that if this virus comes big time, then significant numbers of people will die, just as they die from regular flu every year. But I do think it is important, first of all, to recognise the NHS is under enormous strain at the moment. Virtually every hospital is full at the moment. But what the NHS is good at is flexing so that it will then choose the most ill people and keep them in hospital. Those who are less ill or those who are coming in for routine operations won't need it. That will create space in order to treat those who will need treatment. At some point, of course, it may be that there are just too many people requiring that form of treatment.
When you look at the figures for NHS England, there were only 1,000 critical care beds available in December. Is there a case, do you think, for making hospital beds available elsewhere, schools, requisitioning schools and turning them into hospitals?
Not necessarily, but what really worries me is why do we have a quarter of the number of intensive beds that Germany have, which is a similar economy?
Can you answer that?
No, I think we do need more intensive care beds. The reality is that the healthcare system has been consistently underfunded for a long period of time, and only in recent times has sufficient more investment being put in. But even that level of investment, I think, leaves us a long way to catch up in order to be able to provide the kind of services we need.
So really, this pandemic, if it becomes a pandemic, has come at the worst possible time.
Well, I worry about my patients who come in to see me who might be care workers on 0-hour contracts. I know already that if they don't go out to see vulnerable patients in their homes, they may not have the money to buy food for their children. This is underinvestment coming home to roost in both the healthcare and the social care service.
The Prime Minister says that schools and public places will be closed on scientific advice. What would your advice be to him about when that should be done to prevent the spread of this? You're clearly worried about the implications of widespread spread. How nip it in the bud?
Well, I'm not a clinician, so I would absolutely rely on clinical advice as to when those measures should be taken. There's no doubt there's quite a lot that people individually can do at the moment. And I would say, just in relation to 111, that there is now an online version, and that is a better form of, and you're likely to get a better answer more quickly.
Well, you are a clinician, so your very quick response to that. When do you close schools and public places?
So I will listen to the Chief Medical Officer regarding schools, but my GP practices, my colleagues there need to be treated as professionals and allowed to make decisions about when they close down things like direct access to face-to-face appointments. So you do need to allow GP practices to make those decisions based on their knowledge.
Dr. Helena McCorn and Niall Dickson, thank you both very much. Krish.
Well, Ryanair has become the latest